Srija. So today in this session you are going to learn about the classification of ICD-10 coding for diseases of the nervous system. So coming to code ranges G35 to G37. So what are the demyelinating diseases of the central nervous system? So what do you mean by demyelinating diseases? So these codes are used for the diseases where the myelin sheath gets damaged. So what is the myelin sheath? It's a protective covering around the nerves in the brain and spinal cord. So there will be a damage. So when myelin is damaged, the nerve signals slow down and they get blocked. So just like a damaged insulation on an electric wire. So coming to code G35, G35 is assigned for multiple sclerosis. So what do you mean by multiple sclerosis? It's a long-term disease where the immune system attacks the myelin in the brain and spinal cord. So because of this multiple sclerosis, the messages from the brain do not travel properly. So they can cause the weakness, vision problems, numbness, balance issues, etc. So there are no subcodes under G35 in ICD-10-CM. So here you can see the picture of the multiple sclerosis. It's a normal nerve. This is a nerve affected by multiple sclerosis. Here you can see a smooth intact myelin. So it's a normal myelin sheath, right? So signals move faster. So coming to the multiple sclerosis myelin, here you can see the damaged myelin. In this case, when the myelin is damaged, you can see a signal slow down and they block the nerve signals. So this is about the G35 code description. So coming to G36, what it is? Other acute disseminated demyelination. So this code covers the sudden onset demyelinating diseases that are not part of a multiple sclerosis. So what do you mean by acute? Short term, right? It starts suddenly. So disseminated means it affects multiple areas of the brain or spinal cord. So in this case, the myelin damage happens quickly and also it causes a sudden symptoms like weakness, vision loss or coordination problems. Okay, and what are the examples of this G36 code? What are the subcodes? So G36.0, it's a neuromyelitis optica. It is also called as Devick's disease. So what is the condition? How do you call as Devick's disease? So here it is a condition that mainly affects the optic nerves. The name it says the optica, right? So the condition that mainly affects the optic nerves, that is eyes, and also the spinal cord. So they cause the vision problems and limb weakness. So this is about the neuromyelitis optica. Then coming to G36.8, it's a other specified acute disseminated demyelination. So what do you mean by it? It is used for the other acute demyelinating conditions that don't fit into a specific name disease. So in this slide, it's easy to remember. What do you remember? So G35 you should assign whenever a patient is diagnosed with the multiple sclerosis, means a long-term myelin damage, and G36 for the sudden onset myelin damage disorders but not the multiple sclerosis. And these both affect G35 and G36 codes. These both affect the brain and spinal cord, slowing the nerve messages. So next, G37. So other demyelinating diseases of central nervous system. So these are the problems where the myelin sheath, that is the protective layer around the nerves in the brain and spinal cord, they gets damaged, right? When myelin sheath gets damaged, but they do not fit under G35 multiple sclerosis or the acute conditions G36. Those are involved in this G37. So what does G37 include? It includes the long-term or specific types of demyelination. So the conditions that don't exactly match multiple sclerosis or they don't exactly match the sudden onset of the demyelination. So what are the billable subcodes under G37? G37.0, it's a central demyelination of the corpus callosum. So what do you mean by corpus callosum? It's a bridge, right? It's a bridge connecting two brain hemispheres. So I have shown you in the brain anatomy. It's a bridge connecting the two brain hemispheres. So whenever the myelin is damaged, so the communication between the two sides of the brain becomes slow, right? So that is the condition of the central demyelination of the corpus callosum. So coming to G37.2 code, it is assigned for other specified myelinopathies. So this is used for the other specific types of nerve. Myelin damage is not listed under the other codes. So next, episodic and paroxysmal disorders. What are the code ranges? G40 to G47. So these conditions, they occur in episodes. This means they start suddenly, they can last for short or long periods, they may stop and then they can come back, right? So G40, it's epilepsy and recurrent seizures. So what is epilepsy? What do you mean by epilepsy? It means a person has a repeated seizures. So which happen because of the abnormal activity, I mean electrical activity in the brain, like a electrical short circuit, right? So this is about the epilepsy. So what is the subcode? What is the subcode of G40? It's G40.0, the localization related or focal epilepsy. So what do you mean by localization related? So this means the seizure starts in one specific area, right? Localization means a place, a specific area. So this means the seizure starts in one specific area of the brain. So at the right side, you can see the common symptoms of the epilepsy. So what are the common symptoms? The loss of consciousness, weakness, anxiety, staring, contraction and jerking of muscles, and also you can see the confused speech. So these are the common symptoms of the epilepsy. So G37 should be assigned for other types of long-term or specific myelin damage, and G40 for epilepsy and recurrent seizures or repeated seizures due to the abnormal electrical activity in the brain. So next, G41. What it is? Status epilepticus. So what it is? So what do you mean by status epilepticus? So it's a medical emergency where a seizure lasts more than 5 minutes, or a person has multiple seizures back to back without waking up or recovery in between. So this is dangerous. This condition is more dangerous because the brain does not get enough oxygen during the long seizures, right? Brain is insufficient to produce the oxygen. So what are the subcodes of status epilepticus? G41.0, G41.1. So G41.0 is a grand mal status epilepticus. So what do you mean by it? A long-lasting convulsive seizures with shaking and loss of consciousness. Whereas G41.1, it is petit mal status epilepticus. So it is a long-lasting absence seizures. So in this case, it's a convulsive seizure, and in this case, it's a absence seizure, right? So this is about the status epilepticus. So next, G43 code is assigned for migraine. So what do you mean by migraine? It's a neurological headache that usually throbs or pulses, happens on one side of the head, and it comes with the nausea, vomiting and sensitivity to light or sound. So you have subcodes of migraine: G43.0, migraine without aura, and G43.1, migraine with aura. Without aura and with aura. So what do you mean by aura? It's a warning signs, right? So with headache happens without warning signs in G43.0, and person gets aura before the headache, visual flashes, zigzag lines, blind spots, tingling, etc. can happen in the G43.1 code. So what are the common migraine triggers? Here you can see the picture. What are the common migraine triggers? You can experience the lack of sleep, stress and anxiety, caffeine, skipped meals, and also the physical exertion. So next, coming to G44 code. So G44 code is assigned for other headache syndromes. So what does this include? Headaches that do not fit into the migraine category. Right, if there is a headache, it comes under migraine category. So that headaches that do not fit into migraine category are included in G44. So example, G44.0 code for cluster headaches. So what do you mean by cluster headaches? The headaches, it's a very severe, a one-sided headache around the eye. So these comes in the clusters, right? So they may attack over days or weeks. And next, G45, transient cerebral ischemic attacks. So it's also called as TIAs in short. So what is TIA? It's a mini stroke. So it happens whenever the blood flow to the part of the brain is briefly reduced. So this causes the stroke-like symptoms. But the important point is the symptom disappears within the 24 hours. So TIAs are warning signs that a real stroke may happen soon. So this just acts as a warning sign. So what is the subcode of G45? It's G45.0, a vertebrae bacillar TIA. So what it is? So it is the reduced blood flow in the vertebral and basilar arteries. The name itself tell you the vertebral and basilar transient cerebral ischemic attacks. So the reduced blood flow in the vertebral and basilar arteries. So this supplies the blood to the back part of the brain. Okay. And then next code is G46. So what is G46? It's a vascular syndromes of brain in cerebrovascular disease. So whenever a patient is diagnosed with vascular syndromes of brain in cerebrovascular disease, you just assign the code G46. So these codes are used when a stroke causes a specific brain syndrome due to a vascular blockage. So basically when a stroke affects a specific artery and it produces a specific pattern of symptoms. So G46 is used in that situation, in that condition. So whenever a stroke affects a specific artery and produces a specific pattern of the symptoms. So for example, G46.0 code is assigned for middle cerebral artery syndrome. So what it is? A problem caused by the blockage of the middle cerebral artery. So it affects the movement, speech, facial muscles and etc. So next is about G47 code. G47 is assigned for the sleep disorder. So what does this include? It covers any condition that affects the sleep quality, sleep breathing, sleep timing and or sleep behavior. So what is the subcode? G470 for insomnia. So what is the condition called as insomnia? What it is? Insomnia is nothing but trouble falling asleep or staying asleep even when someone has the chance to sleep. So it's very difficult to sleep, right? The condition is insomnia. So people who are suffering with insomnia, they do have a lack of sleep. They do not get sleep properly. And so what is the importance of the insomnia and sleep deprivation? So here you can see a picture at the right side. So it is showing the difference between insomnia and sleep deprivation. So in insomnia here, person can sleep, time is available, but their body and mind won't let them to sleep. Did you get my point right? So here person can sleep, time is available for them to sleep, but their body or mind won't let them to sleep. So coming to sleep deprivation, here person can sleep because they do not have enough opportunity. Enough opportunity means like work, stress, lifestyle, etc. So this is the main difference between insomnia and sleep deprivation. So this is about the G45, G46 and G47 codes. So next coming to nerve root and plexus disorders. So this ICD code ranges from G50 to G59. So these codes include the problems affecting the nerves of head, face, neck, arms and legs. So this include both cranial nerves and peripheral nerves. So G50, it's a disorders of trigeminal nerve. First of all, what is the trigeminal nerve? Trigeminal nerve, it's a main sensory nerve of the face, right? So it also controls the chewing muscles. So what is the example of G50? G50.0. It is assigned for trigeminal neuralgia. So what do you mean by trigeminal neuralgia? It's a condition causing sudden severe electric shock like facial pain. So this pain may be triggered by touching the cheek, talking or even the light wind. So what is the example? When a patient feels sharp stabbing pain when they lightly touch their face is nothing but it's a trigeminal neuralgia. So G51. So G51 is assigned whenever a patient is diagnosed with the facial nerve disorder. So what is facial nerve? It controls the facial expressions like smiling and blinking. It also controls the taste on the front of the tongue and tear and also the salivary glands. So G51 is coded for the facial nerve disorders. So next G51.0, it is Bell's palsy. So what do you mean by Bell's palsy? It is a sudden one-sided facial paralysis or drooping. The name itself gives you palsy means paralysis. So sudden one-sided facial paralysis, right? So the patient may not be able to close one eye, smile properly, or move that side of the face. For example, when a patient comes with mouth drooping on one side and cannot close the eye on the same side. So this is an example of the Bell's palsy. At the right side, you can see the picture of the facial palsy. This diagram shows how the damage to facial nerve leads to the drooping eye. You can see the drooping eye, the drooping mouth, and also the facial weakness. So it can be due to the stroke like upper nerve damage, or also the Bell's palsy like lower nerve damage. So this is about the G51.0. So coming to G52. So what is G52? It is assigned for disorders of the other cranial nerves. So these are the problems involving cranial nerves other than the trigeminal nerve. So if it is trigeminal, you have to assign G50. If it's facial nerve, you have to assign G51. But these are the problems involving cranial nerves other than the G50 and G51. So it is included in the G52. So these nerves control the smell, taste, speech, throat and swallowing, and also the shoulder movement. So for example, olfactory nerve disorders, nothing but trouble with the smell. So the picture shows the olfactory nerve inside the nose over here. And G53, it's a cranial nerve disorders in disease classified elsewhere. So when this code is used, it is used a cranial nerve problem. It happens because of the another disease, but not on its own. For example, a facial nerve palsy due to diabetes, a cranial nerve weakness caused by infection or tumors. So a nerve problem is always happened because of the another disease, but it cannot happen on its own. This is the meaning of the G53 code. So coming to G54, nerve root and plexus disorders. So what are nerve roots? The areas where the nerves exist, the spinal cord. So what are plexuses? Plexuses are nothing but the networks of the nerves controlling movement and sensation in the limbs. So these orders lead to weakness, numbness, and also the tingling and loss of sensation in arms or legs. So what is the example subcode of G54? G54.0, the brachial plexus disorders. So it is a brachial plexus is nothing but the large network controlling the shoulder, arm, and hand. So what is the common example of this? A birth brachial plexus injury. So the baby has shoulder or arm weakness, or they cannot move the arm well, right? So this is the difference between G52, G53 and G54 ICD codes. So next coming to G55. So G55 is a compression of nerve roots and plexus in diseases classified elsewhere. So what is G55? So what does it mean? What does compression of nerve roots and plexus means? Nerve compression happens because of the another disease but not by itself, right? So we have to use G55 whenever the cause is something like cancer, bone infection, and the herniated disc, and also the tumor pestering on the nerve. So what is important? So you must first code the main disease, then add G55. So what is the example of G55? A spinal tumor presses on the sciatic nerve, causing the sciatic pain. So you have to code the spinal tumor. Then you have to add G55. So coming to G56, it's a mononeuropathies of the upper limb. So these are the single nerve injury and compression in the arm or the hand. For example, carpal tunnel syndrome. So do you know about the carpal tunnel syndrome? It is also called as a median nerve syndrome. So the compression takes place at the medial nerve at the wrist. So it causes a carpal tunnel syndrome. So what does it happens whenever the carpal tunnel syndrome attacks? You can see the tingling in the, you can see the numbness in the thumb. Also, you can see the numbness in the index finger, middle finger, and half of the ring finger. So what is the easy example of the G56? It's when a person feels numbness in the thumb and the first three categories. So carpal tunnel syndrome, you have to assign the code G56.0. So next G57. G57 is for the mononeuropathies of the lower limb. So what is the meaning of the mononeuropathies of the lower limb? A single nerve injury in the legs or the feet. Mono means single, right? Yeah, mono means single. So single nerve injury in the legs or feet. So what is the example of the subcode? G57.0. It is sciatic nerve lesion. So what are the symptoms? Sharp shooting pain. So it radiates from the lower back down to the leg and then to the foot. So what is the easy example to you to understand the mononeuropathies of the lower limb? So pain traveling from back to foot like an electric shock. Then you have to assign the code sciatic nerve lesion, which is G57.0 code. So whenever a patient is diagnosed with sciatic nerve lesion, you have to assign the code G57.0. So in the right side, you can see the picture of the carpal tunnel syndrome, which is an example of G56, nothing but mononeuropathies of the upper limb, right? So this picture shows the hand and wrist focusing on a narrow passage called the carpal tunnel. So what is carpal tunnel? It is a small space in your wrist, so which is made up of the carpal bones at the bottom and transverse carpal ligaments at the top. So this space is very tight, so like a narrow tunnel. So what passes through this tunnel? The most important structure passing through this tunnel is the median nerve. So this nerve gives the feeling to the all the fingers like thumb, index finger, middle finger, half of the ring finger. So it also helps in the movement of the some thumb muscles. So what happens in carpal tunnel syndrome? The median nerve becomes squeezed or compressed. You can see here the median nerve is compressed or squeezed inside the narrow tunnel. So because the tunnel is already tight, even a small swelling can press on the nerve. You can see the swelling and compression over here in the picture. So because the median nerve is compressed, the person feels numbness, tingling, burning sensation, and also person feel the pain in the thumb, index, middle, and sometimes the ring finger. So why does it happen? It happens because the common causes of the carpal tunnel syndrome is repetitive hand or wrist movement. So whenever you use the hand or wrist repetitively, you can find this syndrome. So prolonged typing or gripping. So also swelling during the pregnancy. Even pregnant women, they can see the swelling and they can experience this carpal tunnel syndrome. So it also happens due to the wrist injury and also the arthritis. So this is about the carpal tunnel syndrome for the ICD-10 CM code G56.0. So next coming to G58. So what is G58? The other mononeuropathies. So what is other mononeuropathies? These codes are used when only one nerve is affected but not in the arm or leg specifically. You got my point, right? Only one nerve. Mono means only one nerve, right? Only one nerve is affected, but not in the places of arm or leg, but in the other places. So damage to only one specific nerve. For example, the intercostal nerve pain. Nothing but intercostal nerve is the nerve between the ribs. So intercostal nerve pain is nothing but you feel pain in the nerves between the ribs. So whenever the other mononeuropathies is diagnosed, you have to assign the code G58. So next coming to G59. It's a mononeuropathies in diseases classified elsewhere. So you have to use G59 when the nerve damage is caused by the another disease. So you must use the underlying disease first, then G59. You have to code the underlying disease first and then the G59. So what are the conditions that causes mononeuropathy? Diabetes, herpes zoster, and also the autoimmune diseases. So for example, the diabetic neuropathy of sciatic nerve. So you have to code diabetes first and then G59. So this shows that neuropathy happened because of the diabetes. So next coming to polyneuropathies and other nerve disorders, the ICD-10 CM code ranges from G60 to G65. So these codes are used when many peripheral nerves are affected. So not just one, many. So what are the typical symptoms of polyneuropathies? You can feel numbness, tingling, weakness, burning pain, loss of reflexes. And also what are the common causes of these polyneuropathies? Diabetes, alcohol abuse, vitamin deficiencies, and also the autoimmune disorders. So this category includes a wide range of polyneuropathies. So next, G60 code, the hereditary and idiopathic neuropathy. So what it is? So these neuropathies are not caused by diabetes. These are not caused by another disease. So they can be genetic or unknown. So coming to G60.0 code, it's a hereditary motor and sensory neuropathy. So what it is? It is also known as the Charcot-Marie-Tooth disease. So what happens in this condition? So you can see foot deformities, and also you can see the muscle wasting in legs, difficulty in walking, and also balance problems. You can also see the foot drop, nothing but the toes drag while the walking. So this happens in this condition in Charcot-Marie-Tooth disease. So what is the example of G60.0 code? A teen with foot drop and very high arched feet. So in this case, you have to assign the code G60.0. So next, G61, it is inflammatory polyneuropathy. So what do you mean by inflammatory polyneuropathy? So this neuropathies happen due to the inflammation of the peripheral nerves. So they often very suddenly. So what is the example? G61.0 code for Guillain-Barré syndrome, nothing but GBS. So what are the key features of this syndrome? Acute ascending weakness, nothing but the syndrome, it starts in the legs and it moves the upward. So it often occurs after a viral infection. So the myelin sheath, so you can see over here, myelin sheath gets damaged and it slows down the nerve signals. So for example, when a patient develops leg weakness after a viral infection, which spreads upward. So you have to assign the code G61.0. At the right side, here you can see the image of Guillain-Barré syndrome. So you can see the normal nerve and damaged myelin. You can see both the differences. In normal nerve, you have the normal myelin, right? You can see the smooth myelin covering, whereas in Guillain-Barré syndrome, here you can see the damaged myelin. So myelin is damaged over here. This impacts the nerve signal slowing down, and then this weakness, it causes the paralysis. So this is about the Guillain-Barré syndrome. It affects both the nerves in the brain and spinal cord. Yeah, that's it for today's session. I hope this session has helped you to learn about the classification of some of the diseases of the nervous system. So in the next session, you are going to learn about the continuation of this ICD-10 CM codes for nervous system. Thank you.